We are at the start of our trip, about to head off to Ely.
My wet spot. It smells like ham.
Hello.
Yeah.
What's this? Hi. Oh, she's off to sleep already. This is our beautiful van for the trip. Got some snacks for the hotel.
On our way to Ely. This is Ash Springs.
Ash Springs, how far are we?
We're not quite halfway there yet. I should have thrown it away. I'm sorry.
Dad?
Yes. He's making sure we're all safe.
Can you give this away, please? I'm sorry. Please. Sorry, Dad. Thank you.
Sorry, we had a lake. You were sleeping, there was like a lake.
That was a pretty
lake. Did you see it or no?
We have arrived to Ely, Nevada. Hi everyone, how was the car trip?
Oh, no, I slept.
You can ask Tori. I'm tired.
You're tired.
My ass hurts.
Got little cows and margaritas. What are you most looking forward to for this clinical?
The ER.
Just meeting people, working with Lily.
Working with Lily.
I would like to see how the ER works and do a health assessment.
What do you think you're going to be doing for this?
Probably more visual, not so much hands-on I'm expecting, and a lot of note-taking. It's got pretty view. It does. Can you believe that pharmacist is still there?
Hi Bree.
All
of our stuff ready to go. Time for a hotel room tour. Well, we have a sink right there, laundry stuff. Okay, and here's our bathroom. Oh my god, they gave you a rubber ducky. How cute. Okay. We got a nice big bed, a fridge, safe, and a microwave. Awesome. Let's see what our view is. Ooh, grass. Cute. Okay, oh, cool coffee maker. I just need hot water though. So see how that goes. A TV. And we are currently going grocery shopping and I'm trying to figure out which ice cream I want. But it's very difficult because I don't know which ice cream I want.
Hello, Professor. Can you explain what we're going to be doing this week?
We are going to be going to the White Pine County Hospital to do some rural experiences.
What are you expecting for us to learn?
I expect you guys to learn how to talk with patients comfortably, how to do your head-to-toe assessments, and practice your vital signs, things like that. I just finished unpacking and I cooked myself some food, made myself some pot stickers, then some instant rice, and I got an egg. And this is my stocked fridge. A cup of soy sauce from the pot stickers. This came with the fridge, and got a bag of eggs, some Yakult, because of course. I got myself some grapes and bananas to eat as a snack during like lunches. And then I got myself a salad because we need to have those greens. I got myself some coffees. I got pot stickers. I got ice cream. Yeah, and then I also have pizza rolls. And more snacks. I bought a bunch of ramen
and some mac and cheese and some oatmeal. And I've got the rest of my snacks that I bought at the store.
오늘 휴가인데요. 오늘 휴가인데 지금 새벽 2시에 출발을 해서 여기 여러분 새벽 낚시 힘듭니다. 새벽 낚시를
Who wakes up that beautiful? I just did some ATI, some homework, and getting ready to go to clinicals tomorrow. I'm a little nervous just because I don't know how well I am going to be able to interact with the patients. And I haven't practiced doing a head-to-toe assessment in like a month or so, so gotta go refresh that before we actually try to do stuff. I'm really nervous, but also really excited for tomorrow, so we'll see how it all goes. I'm gonna go take a shower, and I'm going to head off to bed. Ooh, y'all look so good. Y'all look so good in your scrubs. Good morning. Don't look at me, I'm hideous. Today I officially had my first day of clinicals. It was a big learning experience. So I am part of the RNPC Scholar Program. And what we do is we go out to rural communities and participate in their healthcare system. So the way that this hospital is set up is there is a clinic side and there is a hospital side. Today one of my classmates got to actually work in the ER. The 7 rest of us got to work in the clinics today, and they separated us, and I got paired off with a medical assistant who worked with a doctor who participated in just general medicine. He worked with all ages. I worked with kids that were 2-3 years old, patients who were above 60 up to even 90 years old. So I just worked with a huge range of people. I was very unprepared as all I've done in school so far is work with just adults, and it's been mostly healthy adults. Today I actually got to have a lot of hands-on experience with the patients, and I was really glad for that. The people that I worked with today were very welcoming and answered every question that I had and were very helpful in guiding with me. So I did height, weight, temperature, oxygen saturation, pulse, and then I also took their blood pressure when we went inside the room. We did manual blood pressure, so not with the machine. We actually had to pump the, I have no idea how to say it, sphagometer, whatever, and we used our stethoscope to listen to the sound. So that is what I'm familiar with practicing, and it's good that we did learn how to do all that. After that, today my doctor actually pulled me into the rooms with the patients and allowed me to practice what I needed to practice. So for this clinical, my big test is basically to perform a head-to-toe assessment on an actual patient. And I've done head-to-toe assessments on my classmates before, and all my classmates are healthy adults, but I actually got to practice on like all different kinds of people, because I myself was a little unprepared going into this clinical today. I didn't expect to actually be so hands-on with the patient today, so I kind of just like blanked the first time I went to go do a head-to-toe assessment. I forgot what I was supposed to do, and then just my flow, very awkward today. Still getting used to talking with patients, and I'm not very comfortable or confident with talking to patients yet. My goal for tomorrow is to be a little more confident in my speech and just kind of just be on it. I think I'm pretty decent at taking vital signs. I mean, we did practice that a lot at the beginning. It's just been a while since I've done a head-to-toe assessment, so I really need to review that. But I really want to hopefully be able to perform a head-to-toe assessment on somebody tomorrow. I do have to get that checked off by my professor, but I really just want to get more hands-on practice with the patients and just be more comfortable with like interviewing patients, like knowing the right questions to ask, really just getting comfortable with the patient, getting comfortable with myself and how I work with the patient. Oh, another big thing that I learned was obviously when you're working with different populations or just different people, not everybody is the same, so you do have to accommodate how you practice to what they are capable of doing. So me working with a 4-year-old is not the same as me working with an 89-year-old. Definitely not the same as working with a healthy adult, which is what I'm used to. So, and like in theory, we have gone over that. Of course, you want to adjust. No one is the same, but it's much easier to do things in theory, like in a classroom than it is to do it in practice. So yeah, it was a cool experience, and I'm gonna go study some more and then eat, and then I'm going to head off to bed, and I'll have clinicals tomorrow. So see you guys. This is tonight's dinner. Got myself some chi라면, an egg, and then some grapes. We just got food. Tiana, what have you done today so far? Today, I dealt with a patient that was a little bit agitated about pain meds, and I got to see a urostomy, so that's it. What did you do today? I helped room some patients, took a lot of vitals, and saw a rectal exam.
Okay, so I would document at 250. It has to be at least 35 decibels. So I would put 35.
Today was a little on the slower side for me. It is a clinic in a rural community that only has so many thousands of people. I didn't get to see any patients until 1:30 p.m. I spent my morning basically just stocking and cleaning some stuff and calling patients to remind them about their appointments tomorrow, and then I watched the nurse as she looked through their charts just to print out the necessary paperwork and like labs and other reports that the doctor may need to know. In the afternoon, I got to go back to the doctor that I had worked with yesterday, and I got to perform a few assessments. I got to perform my actual assessment that my professor had to watch and grade on an adolescent. It's so funny though, because the adolescent age range I believe is 12 to 19, and so I'm here talking about adolescents like I'm not part of that bracket. So after that, I went back to work with my doctor that I was assigned to for the day, and I got to take some more vital signs, and I got to room patients. I also got to see a doctor clean and kind of dress an abscess. I wasn't exactly sure what it was, and I forgot to ask about what it was. I also worked with a patient who had a hearing aid. One thing about me is I can get loud, but when I'm talking to patients in my nice voice or my friendly, welcoming voice, it's not very loud, and so I really need to learn on, being loud. I'm gonna wash up, and then I'm gonna do some homework, and then I'm going to eat, and then probably get ahead on some studying and do some more homework, and then I'm going to go to sleep. So yeah. Morning! Third day of clinicals. Woohoo! Third day of clinicals. So excited. And it's freezing outside. Yes, it's like 15, 20 degrees outside. Freezing. Good morning. Oh my god, you can see your breath. That's what you wanted. Today, I had so much fun in the ER. I got to see a lot of blood and some needles. I got to see people get sick. I got to see people cry. Clean up some throw up and blood. Lots of fun. Jessa, what are we doing with this paper?
We're gonna make a thank you cards for the hospital.
Right back. Okay, so today I got to work in the ER. It's a rural community, so it's not as busy, but I did get to see some really cool stuff today, so I'm very excited. I worked with about 7 patients today. I'm only in fundamentals. I haven't been able to give any medications. I haven't been able to inject anything, put anything into the body. But I did get to see a lot of that today. So I got to see about 4 IVs placed today, and then lots of medications administered, and then a lot of injections. I got to see a lot of IM injections that they gave in the hip area. Someone had gotten cut through the ear into the head. They had a broken orbit. They had a really deep wound in the arm, and it actually went into the muscle, not through the muscle, but into the muscle a little bit. So I got to see stitches. I got to see someone give stitches today. I cleaned up a lot of blood. I got to help with the stitches. The doctor allowed me to help cut the stitches. That was really cool. And I love to see everything happen, so it was very interesting to watch. Did a lot of vitals, but this time instead of manual, I did a lot of, it was all electronic. I really learned a lot today. I learned a lot about prioritization. Like, patient came in today with very, very high blood pressure and didn't take his medication today. We also had very low oxygen saturation, so I got to see the nurse just decide to place him on nasal cannula with 2 liters. It was just really cool to see like nursing prioritization. Like, what are you gonna do first? See them inject lidocaine, and it was right into the wound, which I didn't know that they did, but it was really cool to watch. So gory. I was like cringing, but also like, it was so cool to watch. I had a lot of fun in the ER. I know tomorrow I'm not going to be in the ER again, unfortunately, but still, like, I'm grateful to be in these clinics, and these people are still teaching me stuff. I do learn a lot in the clinics, but I've definitely learned the most that correlates with what I've been taught in class. I learned a lot about that today in the ER. So far, everyone's been very friendly. All the staff has been very friendly. Very easy to get along with, and it was just, everyone's very helpful. So anytime I ask questions, everyone answers them. It's been so cool. And I got to do some stitches. That was just the highlight of my day. I was not expecting to be able to do that today, but I'm very glad that I had that opportunity. I was very happy that everyone just allowed me to just jump in and observe, and a lot of what I did today was observation because I can't do medications yet, but it was still so cool. Oh my god, I'm just like fangirling over today. I'm very excited. I have 1 more day of clinicals left. I'm not expecting tomorrow to be very busy. So, I'll see you guys again tomorrow.
And then I was like, I texted my friend, I was like,
Last day clinical. Last day! Guys, we just finished our first round of clinicals. Yay. How are you feeling today?
Oh, I had fun in ER.
I just got back from my last day clinicals. Today I was just in a clinic and was working with a doctor who was very, very busy. We had appointments like all morning. I actually ended up taking 2 patients to the ER because of their symptoms. Like, one patient came in just to get her medication refilled, but we brought her down to the ER for risk of hypoxia and shortness of breath. I also brought another patient today. He had some sort of like flutter, atrial fibrillation or something like that, and his heart rate was like 130 something, so we brought him in for tachycardia. I did get to feel what an atrial fibrillation feels like in the pulse, radial pulse. It was really interesting to me. Like, when I had first felt it, I like wasn't sure. I was like, this doesn't feel like a regular pulse, and I knew it wasn't regular, but I haven't really dealt with irregularities yet. So I called in the MA, and she, checked and was just like, oh yeah, no, that's irregular. So they got that down for me. I just did a lot more vital signs today, and then we went to go visit a flu clinic. They were doing a drive-by flu clinic at the fire department, and people just that community health thing, immunizing people. So I just got to see that, and now we got off a little early, and we're gonna go have some fun. So that was my clinical experience. I'll see y'all soon. Should we take pictures there, everybody? Bye-bye.
And then she was throwing a coin and she's like, I wish I could.
I was born near the dragon. Here's the dragon. And there's Kim.
So goes the temple. The sun.
Okay.
Are you trying to be?
You're hilarious. Pose, Kim. You got it, girl. Looking for Dracula. Looking for Dracula. But I am not afraid.
Nothing so far.
Well, we went to the Railroad Museum and didn't get to see any ghosts, but it was fun. This is my uniform, my hair, it's braided back, my student, and then I got my Roseman patch and my maroon pants. Oh yeah.